Hello, my name is Sandip Singh Gandham, and I am a MAID Assessor and Provider here in Alberta. In addition, I also serve as a Provincial Medical Lead for Medical Assistance and Dying Care. Today, I would like to give a brief overview of the MAID application process and what it looks like here in Alberta. So what's unique about the Alberta approach is that there is a single central point of access known as the Care Coordination Service, no matter where you live in the province. The Care Coordination Service is divided into 3 teams. Each of the teams serves a different region of the province. So there is one for the Edmonton North Zone, one for the Calgary Central Zone, and one for the South Zone. Each Care Coordination Service team is made up of 1 to 2 nurse navigators. They serve as the primary contact point for all patients, families, and any practitioners or healthcare workers that may be involved in the MAID process. The nurse navigators will help coordinate, support patients and the healthcare practitioners throughout the entire process, from the very start to the final end. The Care Coordination Service can be accessed through 3 ways. Firstly, any patient can contact them directly through email. Their email is maid.careteam@ahs.ca, or patients are welcome to call HealthLink at 811. The operator at HealthLink can either give you the contact information for the Care Coordination team, or if you would like, they can make a referral on your behalf to the care team. This can be helpful if you may not have ready access to electronic equipment, such as email or a computer. And finally, the third way you can contact is by connecting with your own family physician if you live in the community, or if you happen to be in a facility or a hospital, then the physician working there, the nurse practitioner, or any other member of the care team, you can bring up the topic with them, and they can either give you the contact information or make a referral on your behalf to the team. While you are welcome to ask anybody for help to assist with the referral, no actual referral is required to connect with the team. This ensures that all Albertans have easy and ready access to the care team. All of the information related to MAID in Alberta, including the Care Coordination Service contact team info, any required forms that you maybe need to fill out, can all be accessed on the AHS MAID website, which is ahs.ca/MAID. Everyone who applies for MAID must complete a written request. You can download the actual form, which is called the Record of Request, from the MAID website. If you are unable to sign the form yourself, you may ask someone to sign on your behalf. This person, known as the proxy, must meet certain criteria for them to be able to sign on your behalf. The specific criteria are listed on the actual Record of Request form. The form also needs to be witnessed by one independent witness. The criteria of who can be your witness for the form is also listed on the Record of Request form. These criteria include the person must be at least 18 years old and also be able to verify who you are. They can't be someone who may benefit from your death. So for instance, a spouse or a family member who may be listed in your will. They can, however, be someone who is a care provider for you, as long as that person won't be one of the individuals who will be doing the MAID assessment or provision. If you are struggling to find a witness for your form, you can contact the Care Coordination Service team, and they can help provide some suggestions. In many of the cases, the Dying with Dignity Canada team is a service that has helped patients with this step in the past. Once the form is completed, you will need to send it to the Care Coordination Service team. This can be done through many means, including fax, email, or regular mail. Once the signed request form is received by the team, They can then help arrange the following steps. Now, at this stage, you may decide you only wanted to have your request documented, but aren't quite ready or wanting to proceed further, which is completely okay. Your written request will not expire and will remain on file until you are ready to proceed to the next step. At this stage, you will be assessed by two different independent practitioners to determine if you meet all the eligibility criteria and all of the safeguards, both of which are set out by the federal legislation. The assessors must either be a physician or a nurse practitioner. Now, because each of these assessments has to be independent, they will each be done separately on different days. The Care Coordination Service team can help find and arrange these assessments for you. Now, one of the assessors can be whoever is looking after your care at the time. So if you're currently living at home in the community, this could be your family physician. Or if you're in a facility or a hospital, this could be the physician or nurse practitioner that's taking care of you on the unit. Once these assessors are identified, either the Care Coordination Service team or the assessors will likely reach out to you directly to set up a time to book each of these assessments. Now, each of these assessments may vary in how long they take. Sometimes they can be relatively short and straightforward and only take 15 to 20 minutes, whereas other times they may be much longer. The assessment period is also an opportunity for you and your assessors to discuss details of your medical condition and determine if there may be any additional treatment options or supports that you may wish to consider. In some cases, an additional specialist consult may also be necessary to assess if you meet all of the required eligibility criteria. If after both assessments you are found to be eligible, you will have the opportunity to move on to the next step. In this step, there will be discussions between you, the Care Coordination Service team, and the provider regarding where, when, and who you would like present at the actual time of MAID. In terms of locations, there are lots of possibilities. So the provision can take place at the facility that you may be currently at. So for instance, a nursing home. It can occur at the hospital if you happen to be a patient there, or if you're at home, it can take place there as well. We will then work with you to identify a date that works for you and the MAID provider team that will be involved in the provision. Most providers have other clinical responsibilities as well outside of MAID and are working at other sites. So not all dates and times may be possible. We want your experience to be all about honoring you. So any special requests you may have, such as who you want present, any particular prayers, musics, or rituals that are important to you, please let us know so that we can do our best to make it all possible. It is also important to remember that you may change your mind at any time, up to including the final moment. You are welcome to pause, delay, or cancel your request for MAID at any time. At the provision, in addition to the provider, there may also be a nurse present who may assist with getting the IV started, as well as supporting with the medications. Once you are ready on that day, the medications will be given. Within a few minutes after starting, you will begin to fall asleep and not feel any pain. You will then receive the rest of the medications, which will cause your heart to stop. The entire process takes about 5 to 10 minutes from the start of the medications to the end. Those who have attended a MAID provision describe it as being a calm and peaceful experience. The care coordinator team will then follow up with your family or any loved ones to offer their support as needed following the provision. One important thing to keep in mind throughout the process is while we have tried to create a simple and easily accessible MAID service, the actual MAID process itself involves multiple steps, including the multiple independent assessments, all of which can take time to complete. It is not meant for an urgent or emergency service and usually takes many days and often weeks to coordinate and arrange. So we would strongly suggest you contact the MAID Care Coordination Service early as possible if this is something that you are considering. We will definitely do our best to accommodate all patients as quickly as possible and support them through their end of life decisions and wishes.